Welcome, everyone, to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCray.
You know, there are about 125,000 people in this country waiting for an organ transplant, the gift of life. You know how many of those are waiting for a kidney?
Out of 125,000?
Yeah, what percent? Do you have any idea?
Half?
I didn't either. Well, it's 80%,
80%.
A little over 80%. Now, it used to be that patients who were on the kidney transplant list had to wait for someone to die before they could get a kidney. Well, not anymore. You know, all of us have two kidneys.
We do.
And we only need one.
So why not give one away?
There you go.
Over 6,000 people in 2018 chose to do just that. Joining us in studio to tell us more about living kidney donation is Mayo Clinic transplant surgeon Dr. Mikel Prieto. Welcome back to the program.
Thank you.
So, Dr. Prieto, nice to see you. Living kidneys are better, last longer.
Yes, and of course, there's a lot more of them than deceased donors. So really is a great option for patients that need a kidney transplant.
6,000 of them done in 2018. How is 2019 shaping up?
You know, it has been pretty steady. So I think we will probably do a little bit better. I wish I could say that we are dramatically increasing the amount of living donor transplants we do, but it's pretty steady. Has been about the same for a few years.
Of that number, how many of them are from living donors?
Depends on the center and depends on part of the country that you are in. Some places do more living donors than others. For example, here in the Midwest, living donation is very common. But at Mayo particularly, we do a very large percentage of our transplants, kidney transplants are from living donors. But it's an area where we can grow a lot, clearly.
Isn't it true that about a third of your donors are now living donors?
Well, that's true for the country. Actually, in Rochester, at Mayo Clinic, 80% of the transplants we do here are living donors.
Really?
Yes.
80%?
Yes.
And are most of these relatives of the recipient?
There are all kinds. Of course, relatives and close friends are the largest proportion. But sometimes distant relatives or friends of friends or co-workers or even what we call the Good Samaritan donors, which is complete strangers, people that donate a kidney the same way you donate blood. You don't know who's going to get it.
We have met some of those people.
It's
pretty amazing.
Well, and they set up what is called the ladder, the donation chain. Explain how that works.
Well, that's part of a kidney pair donation, which has become a big part of what we do. In the past, when we were offering a living donation, you had to find a donor that matched you. And ideally, some people brought several potential donors, and none of them matched. Either they had the wrong blood group, or they had a lot of antibodies against those donors, or it just simply was not a good match. Today, if you have somebody that is willing to donate a kidney on your behalf, we can always find a home for that kidney and at the same time find a kidney for you. So we basically, you become a part of a kidney swap.
Are most of these patients who are waiting for a kidney getting some sort of treatment, and I mean specifically dialysis?
Well, ideally, and this is the other thing where we do things a little bit ahead of our times here, you want to do, if you can, kidney disease is something that progresses slowly. If you, in an ideal situation, you want to get a living donor kidney before the need for dialysis. So about half of our patients are not yet on dialysis. We can transplant them where we know that they're going to need dialysis soon, but we avoid dialysis altogether by doing typically a living donor transplant before dialysis. This is not what happens in the rest of the world, where most patients that need a transplant spend 1, 2, 3, 4, 5 years on dialysis. But the ideal solution for this problem of kidney failure is to put the new kidney in before the old one fails.
Because you're more healthy before your kidney has failed, of course.
Exactly. It's much better for your body, of course, to basically solve the problem before it gets really bad. And also the quality of life. You know, the quality of life of somebody transplanted is completely normal, while somebody on dialysis there's a significant impediment in the things you can do and what you can do.
And a living kidney has a much longer life than a donated kidney from a dead person?
Well, the main advantage of a living donor is twofold. One, of course, you get a very healthy kidney from a healthy person. So for that reason, as you just correctly said, the life expectancy of a living donor kidney tends to be double than of a deceased donor. But there's another advantage, which is for a deceased donor, you need to wait. You need to wait on average 5 years. So you have to be on dialysis typically for a long time. With a living donor, if the living donor is your spouse or somebody, you find somebody relatively soon, you don't have to wait. As soon as the living donor passes the test and we approve and we say, yes, he's a good donor for you, we can go ahead and do the transplant and get you off dialysis.
Do you have to be a certain age to be a donor? Are you ever too old to donate a kidney?
Well, our age limits are 18. In other words, we don't allow children to donate, and 80. So over 80, we think is very unlikely you would qualify as a donor. We didn't used to have an age, but I suppose if somebody that was 80 that was amazingly healthy and in good shape, we could probably consider it as a donor. We have done donors of 77, 76. Obviously, we don't put those kidneys into 20-year-olds, but typically spouses or brothers and sisters of the same age, they get those kidneys and they do fantastic.
And there are no long-term side effects, correct? I mean, if you are a living donor, you donate one of your 2 kidneys, your life expectancy is basically the same as someone who never donated a kidney. Is that true?
Correct. We have been doing living donors transplants since the beginning of kidney transplantation. In fact, early on in the early 60s, all the kidney transplants were from living donors. So we have over 50 years experience on how these patients do long term. So we know that living donors have a normal, healthy life, long life. And their average life expectancy is as good or better than the rest of the population. So we don't worry too much about those things. Of course, going through surgery requires to select those patients very carefully and make sure that everything is done appropriately so we don't have any negative problems.
What's the main misconception that people have about being a kidney donor?
Well, a very common one, and it's interesting because even our donors, when they come in initially, they are willing to accept this, is that you are going to be somehow crippled for the rest of your life, or that you are going to expect it to have higher incidence of kidney disease or other medical problems because you donated a kidney. Now, a lot of people are willing to accept that, while actually it's not true. Really, we would not be doing so many living donor transplants if we felt that every so often we are hurting somebody. So the only reason why we feel very comfortable with this approach is because we know those patients will recover, will be fine, will be healthy for the rest of their lives.
And the other, that most people would think that you're going to have a big incision on your flank to get the kidney out, but it's minimally invasive, right? You do it with little telescopes.
Yeah, fortunately, for the last 20-something years, we have been able to do the donor surgery laparoscopically. The biggest incision where the kidney comes out is about 3.5 inches, is in the lower abdomen, and the kidney has to come out somehow, so you do need to make a slightly bigger incision. And then there's 2 little tiny incisions that we use for the scopes and so forth. So
and you put that kidney in a sack and just sort of...
No, we actually
right through that little incision, don't you?
No. We actually have the hand port, which is a little device that essentially closes that incision, and we put our hand inside the abdomen. In fact, most of the surgery is done with the surgeon's hand inside the belly, and of course, you have the kidney in your hand when you cut it away from the rest of the tissues, and you pull it out in your hand.
How many have you done?
Well, we just reviewed our literature. Since we started doing laparoscopic surgery here at Mayo, I actually did the first one in 1999. We have done 3,000. I think I've done about 1/3 of those. So
wow.
Yeah, pretty incredible. Living kidney donation, giving the gift of life while you're still alive. The procedure to remove your kidney is minimally invasive. It's pretty incredible. The risks are small, and your long-term survival is about the same as individuals who have not donated a kidney. Pretty amazing.
14 people die every day waiting for a kidney transplant. Maybe giving them one of your good ones, the gift of life, is something to consider. Our thanks to Mayo Clinic transplant surgeon, Dr. Mikel Prieto. Thanks for being here.
You're welcome.
Thanks, Dr. Prieto.